Dr. Melba Vasquez, President of the American Psychological Foundation. I am so happy to be here with you today to share updates on APF's activities and new initiatives. I'm joined by Dr. Michelle Quist Ryder, who leads APF as our CEO. Tonight, we'll be sharing an exclusive first look at APF's 2025 Impact Report, where we'll explore the collective impact that we achieved together. Thanks to you, our incredible community of APF supporters, 2025 was full of significant growth and enabled the foundation to expand its impact even further. We truly couldn't have done this without you. In 2025, the APF team and Board of Trustees chose a single word to guide our work: amplify. At a time when barriers to supporting psychological research and access to quality mental health became increasingly critical, the need to turn up the volume on science, equity, and impact felt urgent. Throughout the year, we prioritized amplifying research by funding, supporting, and disseminating rigorous psychological science. We amplified voices across the field, from students and early career professionals to those who have dedicated their lives to advancing psychology. We amplified APF's mission, ensuring that our work remained anchored in science, innovation, and impact. And most importantly, we amplified psychologists' ability to directly improve lives. Every project we fund creates a ripple effect that extends far beyond its initial investment and far beyond ourselves. A single grant can influence clinical practice, inform policy, shape future research, and ultimately touch thousands of lives. These ripples strengthen the field and expand psychology's capacity to make meaningful change, and your support fuels these ripples and makes amplification possible. As always, APF's impact wouldn't be possible without the hard work and dedication of our funding recipients. To show you just how far APF funding can ripple outward, our impact report highlights a few of our past grantees, from our newest 2025 awardees to recipients from years prior. Many of our grantees go on to develop interventions that reach thousands of people. Some secure additional funding from major institutions like NIMH, while others see their work inform policy, shape clinical practice, improve access to care, and inspire future generations of researchers. In each of these cases, it all started with a single APF grant. As you read about these recipients and their work, imagine the impact of our newest recipients, whose ripple effects are only just starting. In the spirit of Amplify, we moved from intention to action. In 2025, we launched APF Direct Action, designed to bridge the gap between research and real-world implementation. Through these efforts, we expanded the reach of evidence-based psychological science, ensuring that science makes it into practice, into policy, and into communities where it can do the most good. The scale of engagement we've already received has signaled that the demand for psychological expertise and support is growing, not shrinking. We'll be sharing exciting updates about direct action throughout this evening. So I'm going to hand it off to Michelle to share a bit more about what we accomplished last year and where we're heading next. Michelle?
Thank you, Melba. I wanted to start by sharing a quick snapshot of last year's impact quantified into tangible numbers. In 2025, we had over 3,500 applicants to our 88 active programs, awarding over 240 recipients at 143 universities and organizations in 43 different states. Additionally, we received more than 1,200 letters of intent for our direct action visionary grants alone. This is clear evidence of both the demand for funding and the urgency of disseminating and implementing psychological research where it's needed most. Our more than 600 individual donors contributed to a hugely successful year of fundraising. In 2025, our revenue exceeded 4.2 million, including 333,000 of direct contributions to APF, and we distributed more than $2.4 million in direct grant expenses. Every contribution directly fueled innovative research, expanded access to care, and allowed psychology to make a difference. We know that APF's impact extends far beyond these numbers. It lives in the researchers whose careers were springboarded by our funding, and in the individuals and communities strengthened by the research and initiatives that we all support together. Life-changing impact begins with a single act of support, and from there, it ripples outward. As Melba mentioned, this past year, we announced APF Direct Action. Through Direct Action, we're building upon over 70 years of funding innovative psychological research, enabling ideas to cross the critical threshold from possibility to evidence to intervention. Psychological science has the power to change lives, but knowledge alone is not enough. Direct Action works to break barriers in systems, accessibility, and implementation, taking research out of the lab and into the lives of those who need it most. I'm excited to share some of the new direct action programs that we launched in 2025 and share a bit about the impact they've had in only a short amount of time. We awarded 3 direct action visionary grants, which fund innovative interventions based on psychological knowledge that directly address pressing needs of the communities. Our first recipient, Dr. Kiara Alvarez, is already having immense impact on the Latin community facing immigration stress. Here you can see a quick overview of the funded project, and more information can be found in both the Impact Report and on APF's website. In addition, when federal funding cuts hit psychology, APF responded by creating and awarding direct action crisis funding grants, which address immediate needs following grant and funding cancellations. At a moment when critical research faces uncertainty, we are proud to step in and ensure that important work continues without interruption. We've also partnered with various organizations to bring the power of direct action to them. The Jewish Community Mental Health Initiative, APF's inaugural direct action program, is having tremendous impact in the Jewish community. This program provides free, ongoing, clinician-led support groups that offer a safe environment to process complex emotions, traumatic experiences, and grief stemming from the rise in anti-Semitism. In addition, JCMHI conducts ongoing research into the psychological impacts of anti-Semitism and develops resources, workshops, and training. The Group Peer Support Direct Action Program supports the expansion of the GPS model, offering free, evidence-based support groups to even more communities in need. Through this program, GPS will continue to adapt its successful model for diverse populations, meeting the ever-increasing need for accessible mental health support and social connection. And then with the Iowa Psychological Foundation, we're working to provide organizational and infrastructure support as they continue to grow and expand. We're inspired by the momentum of these programs so far, and we're just getting started. We hope you'll stay with us in 2026 for even more exciting initiatives and partnerships through direct action. With all of that, I'm excited to share what's to come for APF in 2026. Through direct action in APF's entire portfolio of programs, we're ready to activate all the groundwork that we've laid to create maximum impact for psychology and people who need it. Our plan for 2026 can be described in 3 words: amplify, strategize, and champion. We want to amplify APF as the go-to foundation to create impact through psychology. We're working to intentionally implement strategies set by the APF Board of Trustees, and we're continuing to sustainably grow APF's initiatives while being vocal and consistent with our values. We also identified our own initiatives that we wanted to elevate through active partnerships. The first listed here, requested by one of our trustees, is a foundational report we are writing with the American Institutes for Research that specifically addresses the behavioral and psychological variables that are contributing to the political and ideological division in the U.S. from a nonpartisan, non-political lens. The second is an initiative working toward advancing mental health parity and insurance reimbursement. I'm hoping to have some exciting announcements about that in the next few months, so stay tuned. These collaborations reflect something important. Psychology's impact multiplies when leadership, research, and philanthropic capital move in coordination. So what's next? We have a lot in store for the next year, and we hope you'll join us as we continue to amplify psychology and our mission. We're planning to develop new resources to help everyone understand what good research and data looks like. We're investing in growth and expanding our work through exciting new partnerships and initiatives while continuing the momentum of direct action. We're ready to fund even more dissemination and implementation projects and new initiatives. As always, we're proud to continue investing in strong, evidence-based research to keep the field moving forward. We're holding more events than ever in 2026, both virtual and in person. So make sure you're signed up for APF's Foundation Insider and event updates so we can let you know when we're in your city, and make sure to come see us at APA Convention in Washington, D.C. this August. So with all of that, I'll hand it back to Melba.
Okay, so before we open the floor for questions or comments or suggestions, I'd like to share my heartfelt thanks to a longstanding member of the APF Board of Trustees who concluded her service in 2025. Dr. J. Gail Beck brought great expertise and passion to our board for several years, and she'll be greatly missed. Finally, thank you to each and every one of the trustees, the donors, the reviewers, the recipients, committee members, and the wonderful team who make the work we do possible. Psychology has immense power, and your dedication and generosity allows you to leverage that knowledge to prioritize people and their well-being. So thank you. We'd now like to open the floor for discussion, so please use the chat or raise your hand if you have a question or would like to contribute. One of the questions that sometimes people do ask is, where do you see the greatest gap between research and real-world impact? I know that research has shown that it takes many years for research to actually get implemented in the clinical community, in counseling and clinical community. And I'm wondering where the biggest gap is.
I've read that it's 17 years. It takes an average of 17 years for that research to be implemented. And even then, the 17 years, I think it's only 6 or 7% that actually makes it across that threshold. And I think one of the reasons that we wanted to start direct action, and one of my passions in coming into APF as the CEO, was that there are a lot of resources that flow into medical interventions and into resources, into creating things for people who have means, and there's so much of the medical model that follows money. And I think that the greatest gap that I see between research and real world impact is in psychology, because it's kind of adjacent to the medical model. There's a lot of reasons that it's just not treated the same as somatic medicine. And so I think that not only do we see this gap in psychological research making this jump into intervention, but then it's even exacerbated more in these communities in need. We just aren't seeing it to the people who really need it the most. There's not a lot of avenues for it to be provided, much less for us to look at new interventions. And that's really that gap I feel like we wanted to step into as APF. Oh, here's a question I just got in the chat. How does direct action complement APF's traditional research programs? Would you like to field that, Melba, or would you like me to?
Well, I can start and then you can pick it up. I think what we're trying to do is take the evidence that we get from the research that our grantees discover through the outcomes of their research, and try to apply it through the interventions that people are wanting to provide to their communities. The research that has been the first of our direct action recipients for the immigration community has been critical in making people feel safer, and the evidence that this year's horrific, in my opinion, strategies for deporting people has had a very, very destructive impact on that community. And knowing what kinds of interventions help people feel safer, and what kinds of community strategies help people feel supported has been very, very important. And so that's sort of, going from the research to intervention. And I think anytime we know what makes a community feel safer, for example, the evidence is out there. And so applying it and funding somebody to apply it is just precious to me. I think it's very important. There are other examples. I mean, the anti-Semitism community, people who've been victims of anti-Semitism or any kind of oppressive behaviors that are going on, especially this year. It has to be helpful, whether people participate directly in support groups or not. It's helpful for them to know that there exists places for them to feel safer, to have support, and to know that those interventions are happening or going on. So I think that's really helpful as well.
I would agree with all of that. And I think in addition, I think I would add that I'm thinking specifically about the peer support groups, right? One of the things that in the peer support groups that they're trying to do is solve the clinician crisis, right? Access to care. And they're citing research that in group that Bethany, correct me if I butcher this, but that group therapy shows really, really promising results as an alternative to individual therapy. So it's a way really that we can expand access and that we can increase equity. And when we think about that 17-year jump, right, of us trying to find this research, validate it, and then get it into communities, then that's not us answering the crises of the present time. So we can complement the research that we're doing. Our researchers are finding the cutting edge, the innovative edge of psychology, and they're really giving us this great knowledge. And so direct action is closing that loop. It's getting it back into the community where it's meant to help. That's what the goal is, right? For psychology is to understand and help humanity. So at least that's how I put it. But so I think that it really, I guess, in short, is how I would say that it complements traditional research programs, is that it closes that loop. I also think it has the impact of getting people excited. I think, a lot of times when you're looking at research, especially psychological research that moves in small increments, it's sometimes hard to get excited about that momentum. When you look at a research study and when you go through and you learn to be a researcher, one of the things that they train you in is how to be very concise about your research. No, sorry, they don't teach you to be concise, not at all. We spend a lot of words, but what they teach you is to be specific about your results, right? That you find this tiny little thing, but that doesn't always translate to lay audiences about what kind of impact that you're having. So a finding that a psychologist can be super excited about because we're like, oh my gosh, we just found this key, to the general audience, it can be like, we found this tiny little key for this tiny little hole that nobody knew was there. So when we're looking at direct action and people are saying, okay, now I get it. And direct action initiatives, when we're moving something past the goalpost of research into evidence, into action, then it's really the culmination of a lot of studies. It's not just that one study, right? At least that's been my experience, is that most of the time you don't get this really impactful intervention after one study. So you take all those incremental actions and you build them into something that people can sink their teeth into. Now they understand what we've been doing. They understand how all this fits together and what kind of impact it can have. So I think it really helps us to elevate the importance of psychological interventions, the importance of what psychology can do, and start to see and get excited about what psychology can do in the world. And so that, I think, complements our research program by giving people a perspective on it, giving people a way to understand it so that they understand its importance and can help it contribute to the world.
You've already started to answer Derek's question. He said, how does direct action honor the foundation and its commitment to psychological research? I'm not sure how much the audience knows that on a weekly basis, board members review recommendations from the dozens of committees that we have that recommend grants for certain awardees. And I am continuously amazed at the research projects going on out there. Some are applicable to clinical work, some are not. Some are, more general psychology, but very, very important, informing us about human behavior. But it is, I always come away excited and happy that we're helping to fund people who are out there doing amazing work in psychological research. And so, yes, finding ways to apply it directly as soon as we can is very exciting, very exciting. Uh, and we've had hundreds and hundreds and hundreds of applications, as you said, Michelle, for our direct action grants in just the first year, and we already have hundreds in the first quarter, and so there's a lot of hunger out there to promote these interventions. That's very, very, very exciting. So makes me very happy. How
Yeah,
about
I
what?
agree with all of that. I think also, like you said, I kind of mentioned this already, but just reiterating the direct action, bringing some excitement and attention, and letting people understand the importance of psychological research and the future that it can have. I think that that's how direct action honors the foundation's commitment.
Mhm, mhm.
Okay, here's one more question. How can APF help elevate the voices of early career psychologists? I think that's a good one. And it's something we've actually been exploring a lot this year. We started our first early career psychology group our advisory group that talks to our trustees, interfaces with the trustees, and gives a lot of good advice on what early career psychologists are facing right now and what could be most helpful to them. Um, we've seen we've talked to them about resources, and I think that's one of the big things that we can potentially do to help is help connect resources, not just financial resources for grants, but advisory resources. We've seen them ask, we've had a few people ask for, help with things like how do you set up a new lab, or how do you go about recruiting, things like that aren't necessarily part of the traditional PhD training. So I'm excited about the prospects. We've been talking to a few partners about how we can put together things like that we can step in and help those ECPs in starting their careers. And I think another way that we traditionally have helped is that a lot of our funding streams are geared toward ECPs. And even if they're not specifically focused on ECPs, we find that's the population that they actually help the most, because we're doing like starter grants, we're doing grants that are not necessarily large in scope, but they're great for a pilot study. And then that pilot study can then go on and be leveraged for more funding from larger funding sources. So we find that is a great help to ECPs. And I think we have a couple ECPs on the call. So if you can think of other ways that it would help, then please absolutely speak up. The other one I think that I've heard recently, really, it was very helpful in helping us see how to look at the evaluations of our grants, because there's sometimes when we're having people review the grants and the grant topics, the grant budgets, those kinds of things. If they haven't necessarily been at the beginning of their career in a while, then sometimes they don't understand that it's a little bit different now than it used to be. So having ECPs come in and say, well, this is what I have to do for my budget. I have less departmental support to go to travel, so I need dissemination money, or open access. I mean, open access is a big thing. And so I need open access funds to be able to publish my research, or things like that wouldn't necessarily have always been really high in priority to make those budgets competitive during the review. But now we understand through the ECPs that this actually is what our researchers really need. So getting that feedback helps us to calibrate our reviews so that we're making sure that we're meeting those needs where they actually are and helping the people that we're hoping to help. All right. Well, if we have no more questions or comments from the audience, then we can probably start to wrap up. Anything further from anybody? All right. Well, thanks so much for coming. We really appreciate you being here and listening to us. And we appreciate your support in 2025 and now in 2026. And we look forward to walking with you into our future.
Yes,
Thanks
thank
so
you
much
so
for
much.
coming.
Bye-bye.